Good morning, everyone. I'm Don Infante, the president of the Regency Oaks Resident Organization. And I'm proud to be here with you all this morning. This is our weekly forum. We have Brant and we have the directors. And I want to take a minute just to thank Brant and to thank the directors for keeping us all safe and keeping us all well fed. We have two things going for us. We're safe and we're well fed, and I hope most of us are in fact happy, and we should be. But before I turn it over to Brant, one more thing. I want to thank each of you who are giving your full cooperation, to making this COVID-19 endeavor successful. So thanks to each of you for what you do. But we have a special guest this morning. We have with us Harry. And Harry is going to talk about the Employee Gift Fund, which, as you know, is an important thing in our community, and we're having a little tough time. So Harry wants to give us some plug. So please, Harry.
Good morning, ladies and gentlemen. Again, my name is Harry Cobo. I'm the chairperson of the Employee Gift Fund. You all saw the boards up. You know it's at beginning of August. We've collected $67,000 so far. And folks, I'm telling you, I'm a little disappointed, especially with the help that you've been given by all the staff, the housekeeping, the security, the maintenance, the administration, housekeeping, everybody else who's working so hard to keep us safe. I realize that some of you may not be happy with things, but thank God for the management. They are keeping you safe. Sometimes you're not as safe as you should be because you go out and you do things you know that you shouldn't be doing and come back and may bring something in, and we don't want that to happen. So let me just say thank you to those who give to the Employee Gift Fund. Let me ask that you search your heart and give above and beyond, which many of you do already. And thank you very much. And now I want to turn it back over to Don Infante.
Okay. Well, I ask you all to listen to Harry's words. Employee Gift Fund takes care of our employees, and it's your chance to show your appreciation for what they do for us all year. So please make a donation to the Employee Gift Fund. And with that, I'm going to turn it over to Brant, please.
Harry, John, thank you very much, and we're delighted that you were able to be with us this morning. Welcome everybody else. This is our weekly forum. It's the 7th of August, and we're glad you're here as well. We're going to get started this morning by looking at the COVID numbers, and we're going to go directly to the board. Tiffany?
You know, it's we've been fighting with COVID now for a little over 5 months, and tracking these numbers on a daily basis, and there hasn't been a tremendous amount of good news. And today we're pretty excited because there is some good news that we get to share. And I think it's really interesting to go back and put things into perspective. If you go back and look, we went on precautions on March 17th. That's the date that you see the first dotted line all the way to the left. That was the first day that Regency Oaks actually entered into precautions. And that first initial round of the virus peaked at about 30 days later in the middle of April. And you can see that the number of new cases, that's what we're looking at here, it rose pretty steadily, and here at about April 17th or so, it peaked a month later. And then it slowly had a steady period for about 60 days where it didn't get much worse, didn't get much better. But look what happened on June 1st and all the way up to the peak, which happened somewhere around the 16th of July. We had nearly 11,000 new cases a day. 400,000 here in the state of Florida. And I think it's interesting to look at what happened with the reopening compared to the initial threat that the virus posed way back in March. Look at the difference in size between those two peaks. So the good news that we're beginning to finally see is it looks like pretty good indicators that the peak has been reached on the second round of the coronavirus, and we've seen a steady decline over the last, it looks like maybe 15 days. If you look at our numbers today, it's about 7,300 new cases overnight, and that's back 15 days ago it was peaking at 14,000 new cases overnight. So this is a really good indicator. It's a decline, it's consistent, it's over a extended period of time, and it looks as if we have broken the back of the virus and stopped the spread for a second time, and that bodes well for us in terms of looking at reopenings and next steps. So this is the same chart, but instead of looking at new cases, which is a leading indicator, we're looking at fatalities, which is a trending result. And so you can see that the number of new cases, the graph looks very similar to the number of deaths. The only difference is the fatalities. They typically run about 21 days behind the number of new cases. But here's something that is really important to look at. If you go back and look at somewhere around July 4th or 5th, it looked like we were at about 50 deaths per day here in Florida. Even with this new peak, we've topped out at about 170 deaths. Now, yes, that is 3 times the number of deaths that we were seeing at the start of July, but in terms of a percentage of new cases, it has been very stable. And so if you were to flatline this graph and overlay it with the number of new cases, you would see stability across a straight graph. So what that means in terms of looking at how is this going to impact us in opening in the future, we never overwhelmed our acute care hospital settings. We never overwhelmed the emergency rooms or the ICUs, and the deaths as a percentage of our population having new cases never significantly increased. All good news as we start to think about next phases of reopening. So one last thing I wanted to look at, this is just the testing overview, and this is actually for the state of Florida. And why this is important is the health experts have pretty much all decided that our ability to test and be able to isolate the occurrence of the virus, and that is going to be key to preventing it as we move forward. And this is just a graphic that sort of takes a look at first our new daily cases. That's the chart on the left. This week it is down. Last week it was stable. The number of daily tests, it's about 1.9 per 1,000 people. And you can see that both are trending down this week and last week. So what you should draw from that is that we have been able, through our testing protocol, to keep track with the suspected COVID new daily cases, and we're getting a handle on who has it, and through the tracking and social interviews that we're doing post-diagnosis, we have been able to control the spread of the virus. The other chart that is really interesting is the one on the far right. That's the daily percentage of positive cases. And although it is up for the last 2 weeks, and if you were to go back 3 or 4 weeks, you would see it's been up every week. The percentage increase has to do with the increased testing as opposed to the percentage of people tested who are showing positive. If you look at the two lines, the top one is the actual number of daily percentage positive, and then the baseline is the dotted line below. You can see it's almost a straight line, so it's very stable. The last figures that I'd like to share with you is what's happening across the United States. We are in day 62 of phase 2. Regency Oaks is in phase 2 now, and we are in section 2. There are 12 sections to our phase 2 recovery, and this week we have advanced to the second section. In the United States, we are sitting at 4,884,000 new cases with 160,000 deaths. The hospitalization rate here in Pinellas County is 1,619, and in our specific zip code, we're at 312. So again, good numbers, and the trend lines are all heading in the right direction. Everything that should be going up is, and everything that should be going down is going down. So good news to share this morning. I'm now going to turn it over to Leslie and ask her to update us with the specific community information. Leslie?
Good morning, Regency Oaks, and happy Friday. Here we have under quarantine for our independent living 27 residents, assisted living 0, and 7 in our skilled nursing for quarantine. For staff members under quarantine, we have 2 in independent living, 1 in assisted living, and 8 in skilled nursing. Just remember, the resident quarantines are residents that have been to the hospital for a non-COVID related stay. They have been away from the campus for an overnight vacation, or they are new residents that have moved in that we request be under quarantine. For staffing here at Regency Oaks, we currently have no residents in any level of care or staff members that are being tested. This is great news. It is now 3 days consecutive. It's now been 3 consecutive days for no testing on campus. This is great news. For our confirmed COVID residents, we have 3. We do believe one of them was a false positive because they were showing no symptoms and tested negative the next day. For employees, we are at 15. So again, our total numbers for residents, 3 positives, but 196 negatives. For employees, 15 positives, but 527 negatives. Thank you.
All right, thank you very much, Leslie. And now we'll go to our administrative reports. We're going to start this morning with Rance Macy, our skilled nursing home administrator. Rance?
Good morning, I'm Rance Macy. I'm the administrator at the health center. We had our every other week testing done last week, and we had 2 positive cases. One is a healthcare worker in the assisted living, and one is a staff member that works in a non-clinical role. Neither one of these staff members had any symptoms, but they are both out of work now until they come back with a doctor's note saying it's safe to come back. Also, I'd like to talk about Rita Casey. As many of you know, her last day will be the 28th of this month. I'm excited to announce that we've hired her replacement. His name is Gary Blair. He's got a lot of experience in this industry. He's new to the area. And I'm excited for you all to meet him. He's very personable. I think he'll do a great job. And also, I'm sure some of you have already heard, but my last day will also be the 28th. I've accepted a position with Brookdale Senior Living in a regional role. And I'm sure my replacement will do just as good of a job as I've done. Thank you.
Good morning, Ricky Baca, Food and Beverage Director. Just a couple quick updates. We're going to be trying to get the beverage card out to you, which is the wine, beer, and soda. We're going to try to do that twice a week, and also having the Haagen-Dazs ice cream once a week, and we will have bananas available in the tavern. Thanks, and have a great day.
Everyone, my name is Darwin Perez with Plan Operations. Just a quick update. Next Tuesday, 11th, we're going to be installing the generator in the north building, the new one. And as you guys noticed, we already started painting, and it's moving forward. Yes. Thank you. I just want to let you know on each of the south and north lobby, there is a post of the colors that we're going to be painting the building. Just a quick update.
Hello, everyone. Lauren Rose, Director of Administrative Services. As our occupancy continues to grow, our storage bin situation has gotten tighter and tighter. There are residents that are using what have been empty storage bins because they've been empty, and now that people are moving in, those bins are being assigned to our new residents. So if by chance you are using a bin in addition to the one that you have been assigned, I'm asking that you please empty it and make sure that your name is on a tag on your storage bin. So if it is in the wrong bin or needs to be moved for some reason, we know who to contact. The tags can be gotten at each front desk, and if you have any questions, don't hesitate to contact me. Thank you and stay well.
Everyone, Jesse Rosalie, your EVS director. I'm excited to share with you guys that we'll be welcoming back the Clearwater Carpets. They will be here on the week of the 15th and 22nd. Expect them to shampoo the 5th and 4th floor, and we will pick up the areas that we need to pick up. Thank you.
Hello, I'm Sandra Novaco, the Human Resources Director. I just want to let you know that all staff will be celebrating Spirit Week next week from Monday, August 10th through Friday, August 14th. It will be taking place in the South Dining Room, so if you do walk by, that is what is going on. In addition, we also kick off our associate survey next week as well to engage our staff and to see how everything's going.
Good morning, Regency Oaks. Tiffany Rivers, your resident program director. I just wanted to remind you that as we are opening the community and our activities are coming back onto our calendar, that we remember to always wear our masks, wash our hands, be as safe as possible, especially with the numbers getting so much better. We want to be as safe as possible. It isn't time for us to lack in those things that we've been doing so well in. As well as on the channel 732, you will notice that we're trying to be as vigilant as possible. You can find all of our schedules, our weekly updates, flyers. If you ever have any questions, maybe take a look at our channel 732. Ginger does a wonderful job at updating that as much as possible, so it's a great mode of communication and information. As well as tonight, we will have country night. So come on down to the Breezeway, enjoy and your social distancing with some country music and hopefully some nice weather. Thank you and have a great weekend.
I'm Christine Sensikovich with Innovative Home Services. We don't have any upcoming estate sales as of yet. We are continuing to offer services for any type of help that you might need. Please contact us at extension 502 and 503. Have a great and safe weekend.
Well, Brant, it seems to me that most of the input that I'm receiving these days is, when are we going to open it back up so residents can have their relatives and their friends come in, and begin to visit? So could you address that for us, please?
Yeah, I'm happy to take that question. So this is driven by the number of new cases. That is the statistic that drives access to the community. And we have seen in the last 5 days, we've seen those number of new cases drop from 14,000 to 7,000 a day. In Pinellas County, it also is dropping. So the trend line is there. In order to move from one section within a phase to another section, we must have 7 consecutive days with no new cases either amongst our residents or our staff. As Leslie mentioned, we are on day 3, and so we certainly are on that trend line. As soon as we would be able to consider the next step, we would have to get 5 additional days with no new increases, which would take us to next Tuesday. So on Tuesday, we would look, if this trend continues, we would look to make the next releases. We will not start by opening up the entire campus. We came with our restrictions. We put our restrictions in place Slowly, step by step, we will remove them in the same manner that we put them in place, slowly and step by step. So the first thing that would happen would be to reopen the exterior side doors. We would do that probably 2 weeks before we would consider reopening the campus to allow outside visitors to have some access. The same thing will happen when we do eventually grant access. Initial access will be granted to visits within your individual apartments. There will not be common area access probably for an additional 2 weeks beyond that. So to answer your question in a very long-winded manner, we're looking at about 35 days before we would be able to open this up more completely for full visitation.
Well, Brant, I've heard some very, very positive feedback on the openings that we've had, the Tuesday talk and the dining talk and the housekeeping talk. And that's all good. And I want to congratulate Dining, by the way, for the fantastic job they did on the wine tasting for the last couple of days. Very, very well done, and our congratulations to Ricky and his crew. So the question is, what else can we expect? What do we see happening with regard to further openings, and when will that be?
Thank you, Don. That's a pretty broad question, so I'm going to give you a broad response. The survey data that we look at and monitor, there are 11 different qualifications that must be met in order for us to move from one section to another section. And as I mentioned, we're in section 2 of phase 2, and that means we would have 9 more sections to get through before we got to phase 3. So I'd like you to think of phase 2 restrictions as being nothing new. So everything that we've started in the first 2 sections of the second phase will continue. It's with just a little bit more freedoms granted as you move from one section to the next. And the next phase, phase 3, is the next phase where we will literally advance all the restrictions. So as we go through phase 2, you're just going to see small nuances that are an improvement one section to the next, but not a significant change. Our next significant changes will not come until phase 3.
We're getting a lot of questions as far as housekeeping, and when can we expect the normal housekeeping to return?
So great question, and the 2 questions that I hear most frequently are, when will dining services, sit-down dining services return, and when will our housekeeping teams be able to get back into apartments to do a full service? And the answer is, as we enter into phase 3, those services will return. The CDC guidelines show both of those to be very high-risk behaviors, and they have prevented us from being able to move forward in phase 1 or 2. So those restrictions are going to stay in place for another 30 days, and then once they we move into phase 3, we'll start to see a resumption of our full housekeeping services and sit-down dining.
I have a question in regards to if we have a decision for our new home health team yet for Regency Oaks.
So great question, and just yesterday we were able to finalize the terms for our new home health agency. It is going to be Grace Home Health Services. Many of you are familiar with some of the players from Grace. You will recognize their names because they used to be the leadership team of our Sylvan Home Health that was located in Sandra Nabodko's old office. And so Stacy is still the director of Grace, and she will be overseeing the operations. Their clinical director is Natalie. Natalie is an RN that is very familiar with our building, was Stacy's director of clinical services 5 years ago. So she is still in place. And Joyce, who is their clinical diagnostician, is still in place as well. And I'm sure all of you will remember Joyce. She had quite an active presence in the community. So that change will be finalized next week. Leslie and I are meeting with the new team and we'll be talking about the processes and the procedures of integrating them into the community life here at Regency Oaks. So we're excited about that and look forward to welcoming Stacy and her team back to Regency Oaks.
Good morning, everyone. Sherry Schoitzo, Director of Financial Services. I wanted to speak to several questions that have come up over the past couple weeks in regards to your monthly service fee increase. As you recall, last year, probably June or July, we did our annual monthly service fee presentation. And what I wanted to remind folks, as you most recently, for some of you, have received your September 1st increase letters and your October 1st increase letters, as well as your December 1st are forthcoming. Please remember that our presentation that we provided to you last year related to the 2020 budget. And with that, we will now do our new monthly service fee presentation. Going forward, we're going to start doing it late September, early October, before the 2021 increase letters are generated. The reason for this is so that we can provide you with more accurate information as what to expect your next annual increase amount to be. So again, the presentation we gave last year during the summer relates to all of your increases from January through December of 2020. If you have any questions, please contact me directly at extension 337. If you would just like a copy of the presentation that we provided last year, since some of you are just recently getting your letters, I'd be happy to provide you a copy with that. One last comment. Anytime that those folks that have My Choice discounts or possibly a permanent discount that has been ongoing year over year, please know that those discounts remain in effect. We do not speak to those in the letter because those are permanent. It is just your basic service rate that will be increased, and that is outlined in the letters that you are receiving. If you have a question on the letters that you've received currently, again, please contact me directly at extension 337. Thank you, and have a great weekend.
Yeah, Brian, I've had several people ask me, I think you briefed maybe a couple weeks ago that you were sending something up concerning dining, but you were waiting for LCS reply. I know what it was, but I don't know if you got an answer back. And two, what is the status of the town hall, go or no go?
So thank you, Harry. And yes, several weeks ago we had sent something up for dining to reintroduce a sit-down indoor dining in our town hall area. We were trying to go back to the buffet that we were offering when the south dining room was closed there for renovations. That was denied. Our timing just wasn't very good. We had requested that at about the same time that the numbers just flew off the chart. And if we can get our next 5 days without any new documented cases, then in fact next Tuesday or Wednesday we will make that application again and try to seek an immediate approval. So I'll keep you updated on that as we get closer to being able to move forward. In terms of The town hall update. Yesterday was a really important meeting. It was the Health Peak Board of Directors meeting, and one of the items on the agenda was the final go, no-go decision for the Regency Oaks expansion of the Town Hall and Wellness Center. I am anxious to hear that news. I was hoping to hear something this morning. I'm sure I'm not their number one priority, but I do expect to hear something early next week, and I hope to be able to share more specifics at Tuesday Talk.
Well, Brant, thank you. Directors, thank you. Well done. You got a lot of information, and a lot of positive things are beginning to happen. So let's continue to work together as a team. Let's continue to make good things happen. So thank you for watching, and have a great weekend, and God bless.